Welcome runners and walkers. I'm here today to talk to you about a part of your body that often gets neglected, but is crucial to improving your balance, your mobility, reducing pain, and helping you with the performance, your feet. Hi there, I'm Dr. Lynne Virant, owner and physical therapist at The Movement Clinic in Pensacola, Florida. And I'm a big believer in the way that you move matters, not just for everyday life, but especially with how you run. And so I want to show you things that you can do to improve your running so you can keep running for life. So why do you want to roll your feet? Well, one, simply by rolling your feet, you're going to improve circulation, so you're going to bring blood flow to the area. What that does is improves the overall mobility of your joints, your muscles, and all the soft tissues. And that's helpful because it's sort of like adding WD-40 to a stuck joint. When it's sticky, you add oil to it, or in our case, blood flow, and all those things start to move better. And then how that helps you is sort of like how your fingers, when you touch things, it allows you to feel what's happening in your fingertips. Well, when your joints move better in your feet, then that can tell the rest of your body what to do every time your foot hits the ground. And then finally, all that ties into improving your recovery and helping you to prevent injuries. So as you're doing this, when it's uncomfortable or you don't want to do it, here's your why. Come on and join me and let's get your gear together. So one of the great things about rolling your feet is you don't need much equipment or anything at all. All you need is a ball that you feel comfortable rolling your feet. The firmer the ball, the more intense the feeling. So if you're just beginning, you might want to start with something softer like a tennis ball. So here I have two different types of balls with different types of intensities. Before you get started, is you want to test to see how you're moving. The test that we're going to use is simply your balance. All you need to do is stand on one leg. So put your feet together, pick up the opposite leg, and just see how you balance naturally. Do your toes grip the ground? Do you lose your balance quite a bit? That's okay. If you lose your balance, just put your foot down. Try both sides. So again, pick up the opposite leg, balance, and you can see on my right side, definitely I'm moving a lot more. I'm not as stable, and I can feel my toes working a little harder. So guess what? I'm going to roll my right side. But you pick the side that you want to improve for right now. When you get ready to roll, you can either do this sitting or standing. I'm going to demonstrate it first in sitting. The key things you want to remember are 3, 5, and 5. What does that mean? You're going to roll 3 key areas 5 times and do 5 movements. Stay with me. I'll show you exactly what I mean. Start on the inside of your foot, just in front of your heel, and you're going to roll to between the toes 1 and 2. Place the foot on the ball. Try to keep your foot flat. You're just going to roll towards the ball of your foot, nice and smooth. And if it starts to wobble around, just slow down. Right? You decide how much pressure you want to put. Continue to breathe. So if you're having difficulty breathing, it's probably too challenging. In fact, if you hit a spot that feels really uncomfortable, you can move away from it and then come back. You got one more. Roll back to your heel and go back to the ball of your foot. Again, you don't have to go to your toes. You're just going to the ball of your foot and then come back. Now hold it there. The last 5 are those 5 movements. You're going to bend your toes down and then lift your toes up. But you want to lift at the ball of your foot, not on your tiptoes. Your tiptoes will bend, but that's not your focus. You want to try to bend the ball of your foot. If you need help, just go ahead and press down with your hand so you get that part of your foot moving. All right, do one more and rest. That's the first 3. The second one, you're going to go to the outside of your foot, just in front of your heel, towards toes 4 and 5. Same thing. Go nice and slow. Continue your breathing. Again, if you hit a spot that feels really uncomfortable, go away from that and then come back later. And then after the 5th one, you're going to go back to the ball of your foot, hold it, and again, just curl those toes. So really simple. So once you got the first one, you just keep repeating it. And that's what makes it simple to do and something that you don't have to work too hard to do. You just have to remember to do it. And then you're going to go to the middle of your foot, just in front of your heel, and you're going to roll towards the ball of your foot between toes 2 through 4. Right? Just go forward and back. So in the first part, we rolled the medial arch or the inside arch. In the second part, we rolled the lateral or the outside arch. This next part that we're doing right now, we're rolling what's called the transverse arch. So the arch is kind of right at the top of your foot, right at the ball of your foot. And there's also another arch in the middle of your foot. We're hitting those 2 key areas. They kind of form up your foot so it hits like a dome effect. But those parts, even though you want it to be like that when you're standing around stable, they need to move when you run and especially when you walk as well. So once you get to that 5th one, just pause. You're going to curl your toes up and down again 5 times, nice and slow. And again, if you're having difficulty with it, just press down and lift up. For a lot of my clients, the first few times that they do this, they really struggle. They didn't realize they had to move their toes that much. But after you practice it 3 to 5 times, once a day at least, they start to get it. And then the last thing is you want to make sure your foot is nice and level. If you need to take a rest, just take your foot off the ball, take a rest. I'm getting a little tired actually holding my leg up. So if you need to, go ahead and do that. Now, after you do those 3 key areas, 5 rolls, 5 movements, you want to retest your motion. So you have to stand back up and test your balance. And hopefully it feels better, maybe the same. It probably won't feel worse. If it does feel worse, go back and try it again. Now, if you have any pain in these areas, anything below a 5 out of 10 is not uncommon. Like I said, avoid that area and come back. If it's a really sharp pain, you definitely don't want to roll that area. And if that persists, then I recommend that you see a healthcare provider to take a look at what might be going on that foot, because that's not common. So let's try that balance again. So stand up with me. Stand on your leg that you just rolled. Pick up the opposite leg. Good. I just lost my balance. There you go. So what do I feel that's a little different? One, I'm not moving quite as much. My toes aren't gripping. I definitely feel like I'm working a lot harder. If that was what you feel too, you might have to roll your foot again. I definitely need to roll my foot again. So how often should you do this? I recommend at least once, if not twice a day. Before you run, after you run, and before you go to bed. The key is consistency. People start to do it, it feels uncomfortable, but then it starts to feel better, and then they want to keep doing it at least once a day. Some common questions people have: is it normal for your foot to be uncomfortable? Well, if one of your key issues is that your foot is typically stiff, then yes, it's going to start off being uncomfortable. But as you continue to do it, mobility will improve and it won't be as uncomfortable. And you actually might forget to do it. If your foot starts to feel stiff again, you know what you need to do. The other key thing is, when should you do it? Well, as I said previously, I recommend you do at least once to twice a day. But some key times that are helpful: if you do it before you run, you could actually roll maybe a little faster just to stimulate those muscles and get you ready to get out for a run. If you do it after the run, I recommend that you slow it down just so you could start to decrease in your nervous system, get some blood flow to those tissues to help with recovery. And then if you tend to be a runner in the morning, I recommend that you do this before you go to bed. You'll tend to wake up with your feet feeling a little bit more mobile and more comfortable. Finally, can you roll other areas? Absolutely. You can roll your calves, you can roll your quads, you can roll your hamstrings, you can roll the muscles of the side of your pelvis or even your back. And I have some videos that you can follow on my YouTube channel just for that. So that's it. The simple technique. It shouldn't take more than 2 to 3 minutes per day, and that's all you need to improve your foot movement and hopefully help you run and walk better for life. If you're experiencing any pain or discomfort, check out my website at getmovingpt.com. Thanks for watching, and don't forget to subscribe for more tips to help you with your running and your performance.